Well, hello and welcome to Ask the Doctor. My name is Jerry McGee and I'll be your host for today's show. We're here in Pittsburgh, Pennsylvania at Wellness Associates with Dr. Eugene Goldberg. Dr. Goldberg, thank you very much for your time today. On today's show, we want to cover the topic of scoliosis. One of our viewers wrote in, their child went through a school screening, determined that they have scoliosis. They'd like to know, can chiropractic care impact that, and what steps should they take? So what can you tell us about this problem of scoliosis?
In my opinion, Jerry, depending on how old the person is, 12, 13, 14, 15, 16, possibly 17, this is when you want to get checked and you want to get fixed, because think of it that the patient is still pliable. So if you have cement that hasn't hardened, that's when you want to make the changes. So as the growth plates close down at 17, 18, it's more difficult to make the positive rehabilitative changes. So if this person is 12, usually a lot of times it's female, 12, 13, 14, 15, 16, 17, that's when they want to come in, that's when they want to get fixed, because as they get over 18, then it's more difficult because the growth plates close down. So that's important to do it early.
Now, when we're talking about these screenings, because one of the things that I know happens in that arena, they'll look at somebody's spine. They normally do just a simple bend down, and it's just a real simple visual screening.
Right.
That person that maybe they say, well, you have a minor scoliosis, really nothing to worry about. You might disagree with that.
You should x-ray it to be sure, okay? Because the x-ray is going to be more specific. To see is to know, not to see is to guess. A lot of times the nurses are guessing. So once we look at the x-ray, we see a scoliosis as an S, okay? You should not have an S curve looking at the spine straight. It should be straight from your occiput all the way down through your pelvis, okay? Now there's a different kind of curve, which is lordotic curves, which is from the side. So if we x-ray the side, you have a C curve here, a C curve kyphotic, and a C lordotic. So there's two kinds of curves. There's the good curve and the bad curve. The scoliosis that we see on the x-ray on the AP view, which is the front view, that's the bad kind of curve.
But even that person, as we look at this example here with our spine, if the school is saying that they have minor scoliosis, nothing, I don't know if I would worry about it. I think from a chiropractic standpoint, we would say that even a minor scoliosis needs to be addressed and corrected to avoid potential future problems.
Because 9 times out of 10, it's going to get worse. It's called the law of entropy. If you have a misaligned vertebrae, has a tendency to get worse over time. So if they're 12, it's going to get worse, 13, 14, 15, 16, 17. So by the time they're 18, it's a lot worse, and it's more difficult to correct it at 18 versus if we nip it in the bud when they're 12. Just like if you had a cavity in your tooth, you get the cavity fixed before it becomes a major cavity or possibly pulling the tooth or a root canal. So it's the same with your spine. We're kind of dentists for the spine.
Okay. Now, since we're talking about these 12, 13, 14, 15-year-old kids, I know in the past we've done some posts on different things for like the backpacks and all that kind of stuff.
Right.
That all plays into this.
Yeah, because it throws your spine forward. When you wear a backpack, it throws your spine forward, which of course puts your spine into flexion, which it's going to affect your neck and your low back, because your neck and low back want to be an extension. Okay, so you just have to listen to what your body's telling you. Your body's going to give you a symptom. So you say a minor misalignment. That's when you get into trouble. That's when you want to nip it in the bud.
So that family or that mother or father that's watching this video right now has that child who's 12, 13, 14 years old. What would you recommend to them? I mean, should they come in for a quick little eval?
Get checked, possibly x-ray them, see exactly what's happened to the spinal dynamics, adjust what we find, correct what we find, and get them fixed up, okay? Because if you don't, if you have a problem, no matter what the problem is, through the law of entropy, the problem is going to get worse. It has to get worse. We can't stay the same. Did you know you can't stay the same?
Yeah.
Bodybuilders know this. If you're a bodybuilder and you don't work out for 2 weeks, guess what? You get worse.
Right.
You have to maintain it.
So I know a lot of people that, prior to the school year, they'll get a dental exam.
Right.
Okay? They'll get an eye exam, making sure their children are ready,
Definitely.
to school. What we're saying here today is that let's get into the habit of having a chiropractic exam prior to going into the school year. Get it, because I think it's important to understand getting a baseline is important for future treatment.
I think I know what you're saying, Jerry. In the future, hopefully very soon, people are going to go up to people and say, who's your dentist? They're going to say, who's your chiropractor?
Right.
And if you say you don't have one, they're going to say, what's the matter with you? Okay, that's how important it is to me.
Right.
Is your spine determines how you feel, your function, your performance, your pain. If you have pain, pins, needles, numbness, or burning anywhere in your upper extremity, lower extremity, your back, neck, it's coming from a pinched nerve. So if you have a pinched nerve, you can take Tylenol from now until Christmas. That's not going to correct the pinched nerve. The only way to correct the pinched nerve is through a chiropractic adjustment.
And I think the other thing that we want to stress to everybody also is if your son or daughter, you know, even outside of scoliosis, but is involved in athletics,
Yes.
Especially contact sports,
Yes.
right?
That's trauma.
That getting that evaluation and maybe some, you know, some repeat checks just to kind of, you know, mid-season, end of season, things like that, can play a major role in that child's overall health.
I'll tell you why, because the condition that you were in before the accident or the trauma determines what your recovery is going to be. So if you get adjusted on a regular basis and you have an incident, an accident, or a school injury, or a sports injury, that's going to determine what your recovery is going to be. So the healthier you are, the better the shape you are before their injury, the better your recovery.
Okay. So, you know, really what we want to stress today when we're looking at the spine, it's critical to develop a baseline, have a good evaluation, not just a visual check. Come in, let Dr. Goldberg take a good look at this, get a baseline, fix any potential problems that are arising at that point, and then look at a prevention program. And I don't think it's ever, you know, too young to get started. I think it's, you know, it doesn't matter if your child's, you know, even under 12, I mean, 8, 6, whatever. I think it is very good to understand the importance of keeping this healthy. And if we can continue to work on the health of our spine, our overall health is going to change. You're going to feel better, which is going to allow you to do better. And life is just going to be a lot, you're going to live a long and healthy life. So we encourage you to pick up the phone, call Wellness Associates, come down, meet Dr. Goldberg, bring your son or daughter in, you know, get that evaluation, see where you're at. And I think you'll be amazed at the results that you'll have and the expertise that Dr. Goldberg brings to the table. So we hope you enjoyed today's episode on scoliosis and understanding the curvature of the back. And if there's any other questions that you have, we encourage you, visit Dr. Goldberg's website at AskDrGoldberg.com. You can enter your questions there. We'll be happy to address those. There's a lot of other great information on that website as well. But most importantly, pick up the phone, give him a call, and come on down and meet him firsthand. I think you'll be impressed with what you're going to find and the results that you're going to achieve. So thank you very much for watching our show today, and we look forward to seeing you on future episodes. Have a great day.